Hello and welcome to the first part of a three-part series where we're going to be celebrating World Cord Blood Day. My name is Dr. Leslie Ann Martin and I'm the Chief Scientific Officer for Cells for Life. Over the next few days we will be providing you with a three-part mini-series looking at the amazing opportunities that cord blood holds for medical therapies. We hope to provide parents with a view of the types of research that's currently being carried out, as well as the diseases and conditions that umbilical cord blood is currently being used for. And with this information, we hope that you'll be able to make an informed decision about whether you wish to store your cord blood or indeed donate it for research. Umbilical cord blood is often thrown away just as a clinical waste after birth, along with the umbilical cord and also the placenta. The umbilical cord blood, which is within the umbilical cord and the placenta, can be procured and stored, and this gives you a rich source of stem cells that can be used for therapies. You're probably aware at the moment cord blood is used for treatment of cancer patients, for instance. So we know that when we give high-dose chemotherapy to patients, often this depletes their bone marrow, and that means that they can no longer fight infections. And we can give them cord blood. So why would you give a patient cord blood? Well, that's interesting, isn't it? Because the cord blood contains many different stem cell populations, and one of them is called the hematopoietic stem cells. These hematopoietic stem cells form the red blood cells within your blood. They carry the oxygen around. But what they also do is produce the cells that are the components of your immune system. So you can imagine that with high-dose chemotherapy, those cells are ablated or lost in the bone marrow, and you can give a patient back cord blood, which will then replenish those sources. But there are also another population of stem cells called the mesenchymal stem cells, and these can basically form any tissue within your body. They're highly plastic. They're rather like a canvas that you can paint on. So they can be used to generate cartilage, bone, for instance, and nerve tissue. And these have obviously, because of this plasticity, gained a lot of interest over recent years, particularly in the field of regenerative medicine. There have been over 40,000 cord blood transplants, treating over 40 to 80 different conditions. And many of these conditions include things like strokes, cerebral palsy, and osteoarthritis. And it's those later ones, osteoarthritis, which is the area that I'm very interested in, those for regenerative medicine. And the reason for this is when you're born, you have a population of stem cells, and these stem cells are able to renew. They're a blank canvas that compose all of the tissue within your body. But as you age, you lose those stem cells. And that's why we get older. This is why we suffer with arthritis and rheumatoid arthritis and many other conditions such as strokes and heart disease. I think all of us have been hit by the COVID-19 pandemic, and you're probably thinking to yourself, well, what have stem cells got to do in this arena? Well, you'd be surprised to know that stem cells are being used to treat COVID patients. The reason for this is that stem cells have the capacity to damp down the immune system. So if we think about a patient who has a SARS-CoV-2 infection, generally when we get an infection, we have very small peptides called cytokines, and they act rather like a conductor, and they conduct our white blood cells, our immune cells, to come in and attack that pathogen. But sometimes those cytokines go wrong. They start conducting far too quickly, and the orchestra gets way too excited. And rather than just attacking the virus, it now starts to attack the lung tissue. It then destroys the tissue, and this is why we see patients going into the ICU units within our NHS hospitals. What we know is that mesenchymal stem cells have the ability to calm the immune system. Not only do they calm the immune system, but they also repair it because of their regenerative capacity. So they repair the lung tissue whilst calming the immune cells. There are several clinical trials that are now ongoing around the world looking at the use of mesenchymal stem cells for the treatment of patients with severe COVID-19 symptoms. These are taking place in Australia, and most notably the FDA has set up a task force in order to explore the use of mesenchymal stem cells for the treatment of COVID. I would recommend that you look at the presentations that will be given by many seminal speakers on World Cord Blood Day on the 17th of November. And these include presentations by Joan Kutzberg from Duke's University. And she's going to be summarising data from clinical trials where cord blood has been used to treat strokes, cerebral palsy, and also autism. So I hope that what I've done here is to give you a small snapshot of the types of therapies that cord blood stem cells are actually being used for now, but also the future. And for me, it's the future that's most exciting.